Basically, we'll study about the how the pathogenesis of drug-induced gingival overgrowth is occur. Let's start. Bismillahirrahmanirrahim. So, it is a complex procedure. First, I want to tell you, it is that procedure or that process or mechanism that we have studied at the start of the. I've told you about the chapter. There is a defect again in the fibroblast, which is responsible for deposition of the matrix. Means it is responsible for the matrix deposition. So what happened? A decrease in activity in the there's a decreased activity in the collagenase and increase in the production of matrix proteins. Collagenase is an enzyme, so when the activity of the collagenase decrease, so it will not break down the matrix proteins. So there is an increased amount of deposition of matrix. How phenytoin? Phenytoin basically elevates the collagen synthesis, which basically make the fibroblast more susceptible to the development of the gingival drug-induced gingival overgrowth. How nifedipine do? Nifedipine do basically a defect. There's a defective in collagen production, so there is a decreased level of the collagenase activity. So there's more collagen deposition. Now, calcium channel blockers basically decrease the calcium channels in the gingival fibroblasts in T cells and affecting the T cells proliferation and activation of collagenase synthesis. Cyclosporine basically directly imparts the collagen synthesis by the gingival fibroblast and increase the level of type 1 and also decrease the matrix metalloproteinase 1 and 3 also. Basically, these drugs not just only affect the collagen but also affect the non-collagenase matrix, and there is also a drug-induced gingival overgrowth. Glycoaminoglycans metabolism is also impaired in these patients. The patients who are taking phenytoin will have impaired glycoaminoglycans metabolism, and and also, in response to cyclosporine A, treatment of gingival fibroblast can occur. Who are taking cyclosporine, so they can have also impaired glycoaminoglycans metabolism impaired. Okay, now basically when there is, in addition to fibroblast metabolism and function, inflammatory regulation of tissue turnover is a major factor in the drug induced gingival overgrowth pathogenesis. Means they are saying fibroblast metabolism and function is very important, and the inflammatory regulation of the tissue turnover is also very important when there is the drug induced gingival overgrowth in pathogenesis. Fibroblasts, what do they proliferate, differentiate, and production of extracellular matrix. But when there's a defect in this mechanism, so there's an increase. So there are, so when so the release of the cytokines and growth factor occurs. With this, there is also basically increased levels of interleukin 6 and interleukin 1b, platelet derived growth factor subunit B, and fibroblast growth factor 2, transforming growth factor B, and connective tissue growth factor is also. Macrophages are the main sources of the release of cytokines. Okay, now we'll study some two important mediators like transforming growth factor B and connective tissue growth factor. Okay, how this basically induce the gingival overgrowth. Okay, so they are saying that the transforming growth factor B1 regulates the cell proliferation and differentiation and activate the gene expression. Okay, now when they those gene expression is for the synthesis of the matrix components like including collagen in cyclosporine A. Means when, okay, then this transforming growth factor B1 they activate or induce the connective tissue growth factor. Okay, and mRNA and then protein expression in the human gingival fibroblast. So this pathway directly regulate the fibrosis and gingival fibroblast lysyl oxidase. Lysyl oxidase, what do it increases the cross linking of collagen. You have remember. Then collagen generation is also occur. Connective tissue growth factor impression is increased in all forms. Means this is in all forms of drug induced gingival growth is increased. Okay, with the highest levels occurring in phenytoin. Means the connective tissue growth factor is more in phenytoin. which is has the highest levels of fibrosis. Means a patient who is taking phenytoin has the highest level of fibrosis. Now, connective tissue growth factor expression is not just limited to the connective tissue itself, it also affects the gingival epithelium, predominantly the basal epithelial cells that are close to connective tissue border. Okay, so they are saying that there is also a study shows that the connective tissue growth factor produced by the gingival epithelium cells also means this growth factor is also produced by the epithelial cells and having a fibrosis in the gingiva means just not connective tissue is responsible, the epithelium is also responsible. Okay, then studies have also shows a unique mechanism for the transforming growth factor b1 induce the connective tissue growth factor expression in the gingival fibroblast regulated also by the prostaglandins E2, and then there is a cyclic AMP, then mitogen activated protein kinase, and then activation of the gene and terminal kinase. So they are saying a key event in the pathogenic mechanism of drug-induced gingival overgrowth is some degree of epithelial mesenchyme transition. Means the epithelium and connective tissue both is responsible to which is induced by these mechanisms. And when there is highly fibrotic tissues, which is characterized by increased epithelial mesenchymal transition, so epithelial cells in the gingiva acquire also fibroblast function. Means in epithelium cells in the gingiva have also the fibroblastic function, and the process is also regulated by the connective tissue growth factor. The molecular pathway of drug-induced gingival growth have been reviews as well. Means they are saying again that it is the key mechanism between drug induced and gingival growth is more the epithelial mesenchymal transition, which is induced by these medications.